41. A patient with TB is placed on airborne precautions. Which of the following is an appropriate nursing intervention? A. Place the patient in a room with negative air pressure. B. Require all staff to wear surgical masks. C. Allow visitors without restrictions. D. Place the patient in a shared room. Answer: A. Place the patient in a room with negative air pressure. Rationale: airborne precautions require placing the patient in a negative air pressure room to prevent the spread of TB. Surgical masks are insufficient, and 95 masks are required. Visitors should be restricted as needed. 42. What is the most common symptom of active pulmonary TB? A. Shortness of breath. B. Night sweats. C. Weight gain. D. Chest pain only. Answer: B. Night sweats. Rationale: classic symptoms of active TB include night sweats, weight loss, fever, and a persistent cough. Shortness of breath and chest pain can occur, but are not as common. 43. Which patient is at the highest risk for developing TB? A. A college student living in a dormitory. B. A healthcare worker treating TB patients. C. A middle-aged man with hypertension. D. A child who received the BCG vaccine. Answer: B. A healthcare worker treating TB patients. Rationale: healthcare workers are at higher risk due to potential exposure. Dormitory living is a risk factor, but not as significant. Hypertension does not increase TB risk, and BCG vaccine reduces the chance of severe TB. 44. A patient with active TB is started on a 4-drug regimen. Which of the following instructions should the nurse include? A. You must take all medications together on an empty stomach. B. You should stop the medication if you feel better. C. You may need liver function tests during treatment. D. Your urine should always be clear. Report any color changes. Answer: C. You may need liver function tests during treatment. Rationale: TB medications can be hepatotoxic, so liver function should be monitored. Patients should never stop medications early. Rifampin can turn urine orange, which is normal. 45. Which of the following is a primary goal of TB treatment? A. To relieve symptoms quickly. B. To prevent the spread of infection. C. To stop all medications after 1 month. D. To reduce fever and cough only. Answer: B. To prevent the spread of infection. Rationale: the main goal of TB treatment is to eliminate the infection and prevent its spread. Symptoms may improve, but full treatment must be completed to prevent drug resistance. 46. What is a significant adverse effect of ethambutol? A. Peripheral neuropathy. B. Optic neuritis. C. Hepatotoxicity. D. Nephrotoxicity. Answer: B. Optic neuritis. Rationale: ethambutol can cause optic neuritis, leading to vision changes, particularly in color discrimination. Patients should have regular eye exams. 47. A patient on isoniazid therapy should be advised to take which vitamin supplement? A. Vitamin D. B. Vitamin B6. C. Vitamin C. D. Vitamin E. Answer: B. Vitamin B6. Rationale: isoniazid can cause peripheral neuropathy, which can be prevented with vitamin B6, pyridoxine supplementation. 48. A patient with latent TB is being evaluated for treatment. Which medication is commonly prescribed for LTBI? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: B. Isoniazid. Rationale: isoniazid INH is commonly used for latent TB infection, LTBI, to prevent progression to active TB. 49. A TB skin test, MAN2 test, is considered positive in an HIV-positive patient if the induration is A. 5 mm or greater. B. 10 mm or greater. C. 15 mm or greater. D. Any induration is positive. Answer: A. 5 mm or greater. Rationale: In immunocompromised patients, such as those with HIV, an induration of 5 millimeters or more is considered positive. 50. Which of the following statements by a TB patient indicates a need for further education? A. I need to cover my mouth when coughing. B. I will take my medications for at least 6 months. C. Once I feel better, I can stop my treatment. D. I may have regular liver function tests during treatment. Answer: C. Once I feel better, I can stop my treatment. Rationale: TB treatment must be completed as prescribed, even if the patient feels better, to prevent drug resistance. 51. What is the purpose of directly observed therapy, DOT? A. To ensure patients do not overdose. B. To improve medication adherence. C. To reduce medication side effects. D. To shorten treatment duration. Answer: B. To improve medication adherence. Rationale: DOT ensures that patients complete their TB treatment correctly, reducing the risk of drug resistance. 52. A patient on rifampin should be informed that A. It can cause urine and tears to turn orange. B. It has no interactions with other drugs. C. It should be stopped immediately if symptoms improve. D. It can cause permanent vision loss. Answer: A. It can cause urine and tears to turn orange. Rationale: rifampin commonly causes harmless orange discoloration of body fluids. Patients should be aware of this to prevent concern. 53. Which TB drug is associated with hepatotoxicity and should be used with caution in patients with liver disease? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. All of the above. Answer: D. All of the above. Rationale: isoniazid, rifampin, and pyrazinamide are all hepatotoxic and should be used cautiously in patients with liver conditions. 54. When can a patient with active TB be considered non-contagious? A. After 1 week of treatment. B. After 2 weeks of effective treatment and symptom improvement. C. After completing 6 months of therapy. D. When fever resolves. Answer: B. After 2 weeks of effective treatment and symptom improvement. Rationale: most TB patients are no longer contagious after 2 weeks of proper treatment, assuming symptoms are improving. 55. What is the hallmark histological finding in tuberculosis? A. Caseating granulomas. B. Non-caseating granulomas. C. Fibrosis without inflammation. D. Neutrophilic infiltration. Answer: A. Caseating granulomas. Rationale: TB is characterized by caseating granulomas, which contain necrotic tissue surrounded by macrophages and lymphocytes. Non-caseating granulomas are seen in diseases like sarcoidosis. 56. What is the most common site of extrapulmonary TB? A. Liver. B. Lymph nodes. C. Heart. D. Skin. Answer: B. Lymph nodes. Rationale: the most common extrapulmonary site for TB is the lymphatic system, particularly in the form of tuberculous lymphadenitis, scrofula. 57. Which diagnostic test is preferred for detecting latent TB? A. Chest X-ray. B. Sputum culture. C. Interferon gamma release assay, IGRA. D. Bronchoscopy. Answer: C. Interferon gamma release assay, IGRA. Rationale: IGRA is preferred for detecting latent TB, especially in patients who have received the BCG vaccine. Chest X-ray and sputum culture are used for active TB. 58. What is the most common cause of treatment failure in TB? A. Drug resistance. B. Non-adherence to medication. C. Incorrect diagnosis. D. Inadequate nutrition. Answer: B. Non-adherence to medication. Rationale: poor adherence leads to treatment failure and drug-resistant TB. Directly observed therapy, DOT, helps ensure adherence. 59. Which TB medication is associated with hyperuricemia? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: C. pyrazinamide. Rationale: pyrazinamide can increase uric acid levels, leading to gout. Patients should be monitored for joint pain and hyperuricemia. 60. What is the primary mechanism of rifampin? A. Inhibits DNA gyrase. B. Inhibits RNA polymerase. C. Inhibits cell wall synthesis. D. Disrupts folic acid metabolism. Answer: B. Inhibits RNA polymerase. Rationale: rifampin inhibits bacterial RNA polymerase, preventing transcription and bacterial replication. 61. Which of the following is not a standard first-line drug for TB treatment? A. Isoniazid. B. Rifampin. C. Ciprofloxacin. D. Ethambutol. Answer: C. Ciprofloxacin. Rationale: ciprofloxacin is a fluoroquinolone, not a first-line TB drug. It is used in multi-drug-resistant TB, MDR-TB, cases. 62. Which population has the highest risk for developing TB? A. Individuals with diabetes. B. Young healthy adults. C. Athletes. D. Pregnant women. Answer: A. Individuals with diabetes. Rationale: diabetes weakens the immune system, increasing susceptibility to TB. Other high-risk groups include those with HIV, malnutrition, and immunosuppression. 63. What is a characteristic finding in a TB chest X-ray? A. Diffuse alveolar infiltrates. B. Cavitary lesions in the upper lobes. C. Cardiomegaly. D. Pleural effusion only. Answer: B. Cavitary lesions in the upper lobes. Rationale: TB commonly affects the upper lobes, forming cavitary lesions due to necrosis. 64. A patient on TB treatment reports tingling in their hands and feet. What is the likely cause? A. Rifampin toxicity. B. Isoniazid-induced peripheral neuropathy. C. Ethambutol-induced optic neuritis. D. Pyrazinamide-induced hyperuricemia. Answer: B. Isoniazid-induced peripheral neuropathy. Rationale: isoniazid can cause peripheral neuropathy due to pyridoxine, vitamin B6 depletion. Supplementation is recommended. 65. Which of the following statements about TB infection control is correct? A. Standard precautions are sufficient. B. Airborne precautions, including an N95 mask, are required. C. Contact precautions are needed. D. TB patients should be placed in a shared room. Answer: B. Airborne precautions, including an N95 mask, are required. Rationale: TB is an airborne disease, requiring an N95 mask and a negative pressure isolation room. 66. Which TB vaccine is used worldwide but not in the United States? A. Bacillus calmette-guerin, BCG. B. Pneumococcal vaccine. C. DTaP vaccine. D. MMR vaccine. Answer: A. Bacillus calmette-guerin, BCG. Rationale: the BCG vaccine is used in many countries, but is not routinely given in the U.S. due to variable efficacy. 67. How is TB spread? A. Airborne droplets. B. Direct skin contact. C. Contaminated food. D. Vector-borne transmission. Answer: A. Airborne droplets. Rationale: TB spreads via airborne droplets when an infected person coughs or sneezes. It is not transmitted by direct skin contact or vectors. 68. What is the most common symptom of pulmonary TB? A. Night sweats.
B. Hemoptysis.
C. Persistent cough. D. Weight gain. Answer: C. Persistent cough. Rationale: a persistent cough lasting more than 3 weeks is the most common symptom of active pulmonary TB. Hemoptysis, night sweats, and weight loss are also common but occur later. 69. Which organ is least commonly affected by extrapulmonary TB? A. Brain.
B. Skin.
C. Spleen. D. Heart. Answer: D. Heart. Rationale: TB can affect many organs, but cardiac involvement, tuberculous pericarditis, is relatively rare compared to TB meningitis, cutaneous TB, or splenic involvement. 70. Which of the following is a major risk factor for reactivation of latent TB? A. Malnutrition. B. Recent travel. C. HIV infection. D. Regular exercise. Answer: C. HIV infection. Rationale: immunosuppression, especially from HIV, increases the risk of reactivation of latent TB. 71. A positive MAN2 (TST) test in an immunocompromised patient is defined as an induration of at least A. 5 mm, B. 10 mm, C. 15 mm, D. 20 mm. Answer: A. 5 mm. Rationale: in high-risk groups, e.g., HIV-positive patients, a TST induration greater than or equal to 5 mm is considered positive. 72. What is the purpose of directly observed therapy (DOT) in TB treatment? A. To prevent drug resistance. B. To shorten treatment duration. C. To avoid drug toxicity. D. To eliminate all side effects. Answer: A. To prevent drug resistance. Rationale: DOT ensures patient adherence, reducing the risk of drug resistance and treatment failure. 73. Which of the following TB medications can cause orange-colored bodily fluids? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: B. Rifampin. Rationale: rifampin commonly causes red-orange discoloration of urine, sweat, and tears. 74. Which TB drug is most associated with optic neuritis? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: C. Ethambutol. Rationale: ethambutol can cause optic neuritis, leading to blurred vision and red-green color blindness. 75. What is the gold standard test for diagnosing active TB? A. Tuberculin skin test, TST. B. Sputum culture. C. Chest X-ray. D. IGRA. Answer: B. Sputum culture. Rationale: sputum culture is the gold standard because it confirms active TB infection by detecting Mycobacterium tuberculosis. 76. What is the most effective way to prevent TB transmission in healthcare settings? A. Standard precautions. B. Airborne precautions with N95 masks. C. Contact precautions. D. Wearing surgical masks only. Answer: B. Airborne precautions with N95 masks. Rationale: TB spreads via airborne droplets, requiring airborne precautions, including N95 respirators and negative pressure rooms. 77. What is the major side effect of isoniazid INH? A. Hepatotoxicity. B. Nephrotoxicity. C. Ototoxicity. D. Cardiotoxicity. Answer: A. Hepatotoxicity. Rationale: INH can cause liver damage. Patients should be monitored for jaundice and elevated liver enzymes. 78. What is the duration of treatment for drug-sensitive TB? A. 2 months. B. 4 months. C. 6 months. D. 12 months. Answer: C. 6 months. Rationale: standard TB treatment lasts 6 months, with RIPE therapy given for the first 2 months, followed by rifampin and isoniazid for 4 more months. 79. Which TB drug is contraindicated in pregnancy? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide is generally avoided in pregnancy due to potential fetal risks. 80. What is a common adverse effect of rifampin? A. Ototoxicity. B. Hepatotoxicity. C. Nephrotoxicity. D. Skin rash. Answer: B. Hepatotoxicity. Rationale: rifampin can cause liver damage and should be monitored in patients with liver disease.